The genicular artery embolization, or GAE, the idea is that you've tried these other conservative options and they either haven't worked for you or they're not working anymore, but you're not ready for that knee replacement yet. And so what this does is we can help with the inflammation, we can help with the pain, and we can hopefully delay the time to you ever needing a knee replacement, if at all. And what we do is we go into the artery with a small catheter, and we go right out to that area, we inject the contrast, we can see all those abnormal vessels going to the synovium, and we'll inject that medicine directly into that area. And what it does is it goes out, these little tiny crystals go out and they block those abnormal vessels temporarily, usually for 3 or 4 days. And then as they melt over time, they kind of will secrete a little bit of anti-inflammatory effect. And so what that does is you block the abnormal vessels going to the synovium will then shrink back down to normal. And in the meantime, you're getting that anti-inflammatory effect. They'll notice pain relief pretty quickly over the first week or so, but it continues to improve for up to 3 to 6 months, and there's been data showing pain relief out to 3 and even 5 years in some studies. I had a patient who, he loves, his favorite thing to do is to work in his yard and mow his grass, right? And he was having a really hard time. He bought his favorite mower. He had to buy a different type of riding mower so he could sit down. He doesn't like it because it's not a zero turn. I mean, he goes all into it, and it's not as good, and I want to ride my other mower, and so after we do treatment on him, he's right back up on the zero turn and getting to do what he wants to do, being able to kneel down in the garden, do his weeding, and it's been proven as patients lose mobility, it actually shortens their lifespan. So we need people up, walking, moving, staying busy, whether it just be walking around the block with a dog or working in the garden or whatever it is they love to do.